Question 1. Investigation of a discrepancy between a patient's reported clinical signs of dehydration and significantly low total protein and albumin levels, where the laboratory has confirmed no instrument malfunctions or reagent issues, requires a systematic approach to identify the root cause. Which of the following represents the most appropriate initial step in the risk assessment process for this laboratory-related discrepancy? Option A. Forming a repeat analysis of the sample using a different analytical method for total protein and albumin. Option B. Consulting with the clinical team to determine if the patient's symptoms are consistent with other conditions that might affect protein levels. Option C. Reviewing the patient's medication list for drugs known to affect protein binding or metabolism. Option D. Verifying the sample collection procedure, including patient hydration status at the time of collection, and the use of appropriate collection tubes. Correct answer is C. Reviewing the patient's medication list for drugs known to affect protein binding or metabolism. Explanation. Scenario analysis. This scenario presents a common challenge in clinical chemistry where a discrepancy exists between a patient's clinical presentation and laboratory results for total protein and albumin. The challenge lies in identifying the root cause of this discrepancy, which could stem from analytical errors, reanalytical issues, or physiological factors. A systematic and risk-based approach is crucial to ensure patient safety and the integrity of diagnostic information. The ABCC certification emphasizes the importance of understanding the analytical process, quality control, and the clinical significance of laboratory results within the U.S. regulatory framework, particularly as it pertains to CLIA, Clinical Laboratory Improvement Amendments, regulations. Correct approach analysis. The correct approach involves a comprehensive investigation that begins with a thorough review of the pre-analytical factors and analytical performance. This includes verifying sample collection and handling, checking for potential interferences, and reviewing quality control data for the specific assay. This aligns with CLIA regulations, which mandate robust quality systems to ensure the accuracy and reliability of laboratory testing. By systematically ruling out pre-analytical and analytical issues, the laboratory can then focus on potential physiological causes for the discrepancy, such as malnutrition, liver disease, or renal disorders, and communicate these findings effectively to the clinician. This methodical approach minimizes the risk of misdiagnosis and ensures that patient care is based on accurate and reliable data. Incorrect approach is analysis. One incorrect approach is to immediately attribute the discrepancy to a physiological cause without first investigating potential laboratory errors. This bypasses critical quality assurance steps mandated by CLIA and increases the risk of reporting inaccurate results. Such an approach fails to uphold the laboratory's responsibility to provide reliable data and could lead to inappropriate clinical decisions. Another incorrect approach is to solely focus on retesting the sample without a systematic investigation of pre-analytical variables. While retesting might be part of the process, neglecting to examine sample integrity, patient preparation, or potential interferences can lead to repeated inaccurate results if the underlying issue is not addressed. This demonstrates a failure to adhere to best practices in laboratory diagnostics and quality management. A third incorrect approach is to dismiss the discrepancy as a minor issue without further investigation, especially if the patient's clinical condition appears stable. CLIA regulations require laboratories to investigate and resolve any deviations from expected results. Ignoring such discrepancies can have serious consequences for patient care if the underlying cause is a significant analytical problem or a serious underlying medical condition. Professional reasoning. When faced with a discrepancy between clinical presentation and laboratory results, a clinical chemist should employ a structured, risk-based approach. This involves 1. Understanding the clinical context. Review the patient's medical history, current condition, and the reason for the test. 2. Investigating pre-analytical factors. Assess sample collection, transport, storage, and processing for any deviations. 3. Evaluating analytical performance. Review instrument calibration, quality control data, proficiency testing results, and reagent lot numbers. 4. Considering potential interferences. Identify any substances that might affect the assay. 5. Exploring physiological causes. If pre-analytical and analytical factors are ruled out, consider underlying medical conditions. 6. Communicating findings. Clearly and concisely report the investigation's findings and any recommended actions to the ordering physician. This systematic process, grounded in regulatory requirements like CLIA and ethical principles of patient safety, ensures the highest quality of laboratory services. Question 2. What factors determine the selection and implementation of appropriate quality control materials and strategies for a clinical chemistry assay to ensure the accuracy and reliability of patient results, consistent with U.S. regulatory requirements for laboratory testing? Option A. The availability of quality control materials from multiple vendors and the historical performance trends of the laboratory. Option B. The cost of the quality control materials and the perceived complexity of the assay. Option C. The specific analytical methods' imprecision and bias, the characteristics of the chosen quality control materials, and the laboratory's established control limits. Option D. The manufacturer's recommended quality control ranges and the frequency of external proficiency testing. The correct answer is C. The specific analytical methods' imprecision and bias, the characteristics of the chosen quality control materials, and the laboratory's established control limits. Explanation. This scenario presents a professional challenge due to the inherent variability in analytical methodologies and the critical need for accurate patient results, which directly impact clinical decision-making and patient care. The ABCC certification emphasizes the competency of clinical chemists in ensuring the reliability and validity of laboratory testing. Careful judgment is required to select and implement appropriate quality control strategies that are sensitive to the specific analytical system and its potential failure modes. The correct approach represents best professional practice because it aligns with the fundamental principles of laboratory quality management as outlined by regulatory bodies such as the Clinical Laboratory Improvement Amendments, CLIA, in the United States, which are the governing regulations for this exam. CLIA mandates that laboratories establish and follow procedures for quality control to ensure the accuracy and reliability of test results. Selecting QC materials that mimic patient samples and establishing appropriate control limits based on the imprecision of the method are crucial for detecting analytical drift or systematic errors. This proactive approach minimizes the risk of reporting erroneous results, thereby protecting patient safety and upholding professional standards. An incorrect approach that relies solely on manufacturer-provided QC ranges fails to account for the specific performance characteristics of the instrument and reagent lot in use within a particular laboratory. This can lead to a false sense of security if the laboratory's actual performance deviates from the idealized manufacturer specifications. Such a failure to establish laboratory-specific QC parameters can be considered a violation of CLIA regulations, which require laboratories to have a quality control program that is adequate for the complexity of the tests performed. Another incorrect approach, focusing only on external proficiency testing, PT, as the sole indicator of performance, is insufficient. While PT is a vital component of quality assurance, it is a periodic assessment and does not provide the real-time monitoring necessary to detect analytical issues that may arise between PT events. Relying solely on PT would neglect the daily assurance of analytical accuracy required by CLIA and could result in a significant period of reporting inaccurate results before the next PT cycle. A third incorrect approach, prioritizing cost-effectiveness over analytical sensitivity in QC material selection, is also professionally unacceptable. While fiscal responsibility is important, it must not compromise the integrity of patient testing. Using QC materials that are not representative of patient samples or that lack the appropriate concentration ranges can lead to undetected analytical errors, violating the CLIA requirement for QC to be sufficient to ensure the accuracy and reliability of test results. The professional reasoning process for similar situations involves a systematic evaluation of the analytical method, its known sources of error, and the regulatory requirements. This includes understanding the imprecision and bias of the method, selecting QC materials that are appropriate for the analytical range and matrix, establishing statistically valid control limits, and implementing a robust QC schedule. When analytical issues are detected, a thorough investigation into the root cause, corrective actions, and re-evaluation of QC parameters are essential steps to ensure the continued accuracy of patient results. Question 3. When evaluating the implementation of a new, highly automated immunoassay analyzer for a critical analyte in a clinical chemistry laboratory, which approach best ensures regulatory compliance and patient safety according to U.S. federal regulations governing laboratory practice. Option A. Utilize the new analyzer for patient testing after performing a limited validation focused on a few key parameters, assuming that its advanced technology inherently guarantees accurate results. Option B. Conduct a comprehensive analytical validation study, including assessment of accuracy, precision, linearity, and interference, using laboratory-specific samples and controls, followed by rigorous quality control and personnel competency assessment before reporting patient results. Option C. Immediately place the new analyzer into routine use for patient testing, relying primarily on the manufacturer's performance specifications and implementing only basic daily quality control checks. Option D. Integrate the new analyzer into the laboratory workflow by performing a comparative study against the existing, older instrumentation, and if results are within a broad acceptable range, begin reporting patient results with minimal additional validation. The correct answer is B. Conduct a comprehensive analytical validation study, including assessment of accuracy, precision, linearity, and interference, using laboratory-specific samples and controls, followed by rigorous quality control and personnel competency assessment before reporting patient results. Explanation. This scenario presents a common implementation challenge in clinical chemistry laboratories, integrating new, advanced instrumentation while ensuring continued compliance with regulatory standards and maintaining patient safety. The challenge lies in balancing the potential benefits of technological advancement with the rigorous requirements for validation, quality control, and personnel competency mandated by the American Board of Clinical Chemistry, ABCC certification framework, which implicitly aligns with CLIA 88 regulations in the United States. The correct approach prioritizes a systematic, evidence-based validation process that directly addresses the performance characteristics of the new instrument in the context of the laboratory's specific patient population and testing menu. This aligns with best professional practice by ensuring that the instrument meets established performance criteria: accuracy, precision, linearity, etc. before patient results are reported. This meticulous validation is a cornerstone of regulatory compliance, as it provides documented evidence that the laboratory is providing reliable and accurate diagnostic information, thereby protecting patient safety and upholding the integrity of clinical decision-making. This approach is ethically sound, as it places patient well-being above expediency. An incorrect approach that bypasses or inadequately performs the validation process is professionally unacceptable due to significant regulatory and ethical failures. For instance, relying solely on manufacturer specifications without independent laboratory verification fails to meet the CLIA 88 requirements for analytical validation and can lead to the reporting of inaccurate patient results. This directly compromises patient safety and violates the ethical obligation of the laboratory professional to provide trustworthy data. Another incorrect approach, such as implementing the instrument with only minimal quality control checks without full validation, also falls short. This demonstrates a disregard for established quality assurance protocols and regulatory mandates, increasing the risk of undetected analytical errors and potentially leading to misdiagnosis or inappropriate treatment. Furthermore, failing to adequately train personnel on the new instrument's operation and troubleshooting before its routine use constitutes a failure in ensuring staff competency, a critical regulatory requirement that directly impacts the reliability of test results and patient safety. The professional reasoning process for such situations involves a structured approach. First, thoroughly understanding the regulatory requirements for analytical validation and quality assurance as outlined by CLIA 88 and interpreted by professional bodies like the ABCC. Second, developing a comprehensive validation plan that includes all necessary performance characteristic studies. Third, executing the validation plan meticulously, documenting all results and deviations. Fourth, establishing robust quality control procedures for the new instrument. Finally, ensuring adequate personnel training and competency assessment. This systematic process ensures that technological advancements are implemented responsibly, maintaining the highest standards of patient care and regulatory compliance. Question 4. Compliance review shows a potential breach in biosafety containment during a routine procedure involving a highly infectious agent, leading to a minor spill within a designated biosafety cabinet. The laboratory director must decide on the immediate course of action. Option A. Instruct the staff involved to clean up the spill using standard personal protective equipment and dispose of all materials used, and proceed with the remaining scheduled tests. Option B. Temporarily halt all work involving infectious agents and conduct a general safety refresher for all laboratory personnel before resuming operations. Option C. Immediately initiate a formal incident investigation, including containment of the affected area, documentation of the event, and assessment of potential exposure, followed by implementation of corrective actions based on the findings. Option D. Inform the laboratory staff verbally about the incident and emphasize the importance of careful handling of specimens in the future, without formal documentation or investigation. The correct answer is C. Immediately initiate a formal incident investigation, including containment of the affected area, documentation of the event, and assessment of potential exposure, followed by implementation of corrective actions based on the findings. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing immediate operational needs with long-term regulatory compliance and patient safety. A laboratory director must interpret and apply complex regulations to a practical situation, ensuring that all personnel understand and adhere to safety protocols. The challenge lies in identifying the most effective and compliant method to address a potential breach, considering the implications for patient care, staff well-being, and legal standing. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a systematic, documented, and compliant response. This involves immediate containment of the hazard, thorough investigation to determine the root cause and extent of the breach, and implementation of corrective actions. This aligns with the principles of good laboratory practice, GLP, and regulatory requirements for quality control and safety management, such as those outlined by the College of American Pathologists, CAP, and the Clinical Laboratory Improvement Amendments, CLIA, in the United States. Specifically, CLIA mandates that laboratories have a quality system that ensures the accuracy and reliability of test results, which includes protocols for handling and reporting adverse events or deviations from standard operating procedures. A documented investigation and corrective action plan are essential for demonstrating compliance and preventing recurrence. Incorrect approach is analysis, an approach that involves immediate disposal of potentially compromised samples without proper documentation or investigation, fails to meet regulatory requirements for sample integrity and traceability. This bypasses the necessary steps to understand the cause of the issue, potentially masking systemic problems and violating CLIA quality system mandates. Another incorrect approach, which focuses solely on staff retraining without a formal investigation or root cause analysis, is insufficient. While retraining is important, it does not address the underlying reason for the safety breach, which could be a procedural flaw, equipment malfunction, or environmental issue. This approach neglects the comprehensive quality management system required by CLIA. Finally, an approach that involves informal communication of the incident to staff without a formal incident report or corrective action plan lacks the necessary documentation and accountability. Regulatory bodies require formal reporting and tracking of incidents to ensure that appropriate measures are taken and that the laboratory is actively managing its risks. This informal method undermines the laboratory's quality assurance program and its ability to demonstrate compliance. Professional reasoning. Professionals should approach such situations by first activating established emergency protocols. This is followed by a thorough, documented investigation to identify the root cause. Based on the findings, a corrective action plan should be developed and implemented, with clear responsibilities and timelines. This plan should include measures to prevent recurrence and may involve staff retraining, equipment recalibration, or procedural revisions. Finally, all actions and findings must be meticulously documented to satisfy regulatory requirements and for internal quality improvement purposes. This systematic approach ensures patient safety, staff well-being, and regulatory compliance. Question 5. The evaluation methodology shows a situation where a clinical chemistry laboratory is experiencing an unexpected increase in reported results for a specific analyte in a patient population receiving a new therapeutic agent. The biochemical principle underlying the assay involves an enzymatic reaction that produces a colorimetric change proportional to the analyte concentration. Clinical team is concerned about potential overtreatment. Which of the following approaches best addresses this situation from a biochemical and analytical perspective? Option A. Immediately assume the new therapeutic agent is causing a false elevation and switch to a different analytical method for this analyte. Option B. Advise the clinical team to adjust the therapeutic dosage based on the current elevated results without further investigation. Option C. Investigate the potential for the new therapeutic agent to biochemically interfere with the enzymatic reaction or the chromogenic substrate, or to alter the analyte's concentration in a way that mimics a true increase. Option D. Attribute the elevated results to normal biological variation and continue routine reporting without further inquiry. Correct answer is C. Investigate the potential for the new therapeutic agent to biochemically interfere with the enzymatic reaction or the chromogenic substrate, or to alter the analyte's concentration in a way that mimics a true increase. Explanation. The evaluation methodology shows a scenario where a clinical chemist must interpret biochemical principles in the context of patient care and laboratory operations. This is professionally challenging because it requires not only a deep understanding of the underlying biochemistry, but also the ability to apply this knowledge to practical laboratory decision-making, considering factors like analytical interference, biological variability, and the clinical significance of results. The pressure to provide accurate and timely results, while adhering to regulatory standards and ensuring patient safety, necessitates careful judgment. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of potential interferences. This aligns with the core principles of clinical chemistry, which demand rigorous analytical validation and quality control to ensure the reliability of patient test results. Specifically, understanding the biochemical basis of an interference, e.g., how a specific substance chemically interacts with the assay reagents or the analyte itself, allows for targeted troubleshooting and mitigation strategies. This approach is directly supported by the regulatory framework of the American Board of Clinical Chemistry, ABCC, which emphasizes the need for laboratory professionals to possess and apply comprehensive knowledge of biochemical principles to maintain high standards of laboratory practice and patient care. Adherence to these principles is crucial for fulfilling the laboratory's role in diagnosis, monitoring, and treatment. An incorrect approach that relies solely on anecdotal experience or assumes a specific interference without biochemical justification fails to meet the standards of scientific rigor expected in clinical chemistry. This can lead to misinterpretation of results, delayed or incorrect diagnoses, and potentially inappropriate patient management. Such an approach may violate regulatory guidelines that mandate thorough method validation and ongoing quality assurance, as it bypasses the systematic investigation required to identify and address analytical issues. Another incorrect approach that involves immediately discarding the assay or ordering a new test without a proper biochemical investigation is inefficient and costly. While sometimes necessary, it represents a failure to apply problem-solving skills rooted in biochemical principles. This can lead to unnecessary resource utilization and may not even resolve the underlying issue if the interference is systemic. It demonstrates a lack of understanding of how to troubleshoot analytical problems effectively. A further incorrect approach that involves reporting results without acknowledging or investigating a potential discrepancy based on a superficial understanding of biochemical interactions is ethically and regulatorily unacceptable. This directly compromises patient safety and the integrity of laboratory data. It fails to uphold the professional responsibility to ensure the accuracy and reliability of all reported results, which is a cornerstone of clinical laboratory practice and is implicitly required by ABCC standards for certification. The professional reasoning process in such situations should involve a structured approach. First, recognize the potential for biochemical interference based on patient history, clinical presentation, or unusual assay results. Second, consult relevant literature and assay documentation to understand the known biochemical interactions and potential interferences for the specific test. Third, hypothesize the most likely biochemical cause of the observed anomaly. Fourth, design and implement targeted troubleshooting steps informed by biochemical principles to confirm or refute the hypothesis. Finally, document all findings and actions and communicate any significant issues to the clinical team. This systematic, biochemically grounded approach ensures that decisions are evidence-based, efficient, and ultimately prioritize patient well-being. Question 6. Benchmark analysis indicates that a clinical chemistry laboratory is considering the implementation of a new reagent for the quantitative analysis of a specific analyte using an existing infrared spectrophotometer. The laboratory has a history of reliable performance with this instrument for other analytes. What is the most appropriate course of action to ensure the accuracy and reliability of results with the new reagent? Option A. Rely solely on the manufacturer's stated performance specifications for the new reagent and instrument without independent laboratory verification. Option B. Proceed with using the new reagent and instrument, assuming that the established quality control for the infrared spectrophotometer will adequately monitor performance. Option C. Conduct a comprehensive validation study of the new reagent and instrument system, including linearity, precision, accuracy, and establishment of appropriate quality control procedures. Option D. Implement the new reagent and instrument immediately, as the infrared spectrophotometry technology is well established and requires no further validation for new reagents. The correct answer is C. Conduct a comprehensive validation study of the new reagent and instrument system, including linearity, precision, accuracy, and establishment of appropriate quality control procedures. Explanation: scenario analysis. This scenario presents a common challenge in clinical chemistry, where a laboratory must ensure the accuracy and reliability of analytical results obtained using infrared spectrophotometry, particularly when analyzing a new or modified reagent. The professional challenge lies in validating the instrument's performance and the reagent's suitability for clinical use, ensuring patient safety and diagnostic integrity. This requires a thorough understanding of spectrophotometric principles, regulatory expectations for laboratory quality, and the specific performance characteristics of the analytical method. Correct approach analysis. The correct approach involves a comprehensive validation process that directly addresses the performance of the infrared spectrophotometer in conjunction with the new reagent. This includes assessing the linearity of the method across a clinically relevant range, evaluating the precision and accuracy of the measurements, and establishing appropriate reference intervals. This systematic approach ensures that the instrument and reagent system can reliably and accurately quantify the analyte of interest. Adherence to guidelines from the American Board of Clinical Chemistry, ABCC, and relevant U.S. regulatory bodies, such as the Clinical Laboratory Improvement Amendments, CLIA, mandates such rigorous validation to guarantee the quality of laboratory testing. This ensures that patient results are dependable for clinical decision-making. Incorrect approach is analysis. One incorrect approach is to solely rely on the manufacturer's specifications for the reagent and instrument, without independent laboratory verification. This fails to account for potential variations in instrument calibration, environmental factors within the specific laboratory, or interactions between the reagent and the laboratory's specific sample matrix. Such an approach violates the principle of laboratory self-governance and quality assurance mandated by CLIA, which requires laboratories to verify the performance of all laboratory tests. Another incorrect approach is to implement the new reagent and instrument without establishing any new quality control, QC, procedures, or adjusting existing ones. This overlooks the critical need to monitor the ongoing performance of the analytical system. Without appropriate QC, deviations in instrument function or reagent integrity may go undetected, leading to inaccurate patient results. This directly contravenes CLIA requirements for ongoing quality control and proficiency testing. A third incorrect approach is to assume that because the infrared spectrophotometer is a well-established technology, no specific validation is needed for a new reagent. While the technology may be familiar, the specific chemical interactions and optical properties of a new reagent can introduce unique analytical challenges. Each new reagent or significant modification to an existing one requires specific validation to ensure it performs as expected within the laboratory's established analytical system. This oversight can lead to systematic errors that are not caught by general instrument QC. Professional reasoning. Professionals in clinical chemistry must adopt a systematic and evidence-based approach to method validation. This involves understanding the analytical principles of the chosen technology, the specific characteristics of the reagents, and the regulatory requirements for laboratory testing. When introducing new reagents or modifying analytical systems, a robust validation plan should be developed and executed. This plan should include assessing linearity, precision, accuracy, detection limits, and interference studies, as well as establishing appropriate QC procedures. The decision-making process should prioritize patient safety and the integrity of diagnostic information, always adhering to the standards set forth by regulatory bodies like CLIA and professional organizations like the APC. Question 7. Strategic planning requires a comprehensive approach to quality control and assurance in a clinical chemistry laboratory. Which of the following strategies best ensures the ongoing accuracy and reliability of patient test results while adhering to regulatory standards? Option A. Implementing a robust quality management system that includes daily calibration checks, regular proficiency testing, internal quality control monitoring with defined acceptable limits, and documented corrective action protocols for any deviations. Option B. Minimizing the frequency of internal quality control testing and relying primarily on external proficiency testing to assess laboratory performance, with the goal of reducing reagent and labor costs. Option C. Delegating the responsibility for reviewing and approving quality control data to junior technologists without requiring senior technologist or supervisor oversight. Option D. Conducting quality control checks only when instrument malfunctions are suspected or reported by clinicians, and documenting these checks on an ad hoc basis. The correct answer is A. Implementing a robust quality management system that includes daily calibration checks, regular proficiency testing, internal quality control monitoring with defined acceptable limits, and documented corrective action protocols for any deviations. Explanation. This scenario presents a common challenge in clinical chemistry laboratories, balancing the need for robust quality control with the operational realities of workflow and resource allocation. The professional challenge lies in ensuring patient safety and accurate diagnostic results while adhering to regulatory mandates and maintaining laboratory efficiency. Careful judgment is required to implement quality assurance measures that are both effective and practical. The correct approach represents best professional practice because it directly aligns with the fundamental principles of quality assurance as mandated by regulatory bodies such as the College of American Pathologists, CAP, and the Centers for Medicare and Medicaid Services, CMS, which are foundational for ABCC certification. This approach prioritizes patient care by ensuring the reliability of test results through systematic monitoring and evaluation. It involves establishing clear protocols for quality control testing, including frequency, acceptable ranges, and corrective actions, as well as regular proficiency testing and internal audits. This proactive and systematic approach minimizes the risk of reporting erroneous results, which could lead to misdiagnosis, inappropriate treatment, and patient harm. An incorrect approach that focuses solely on cost reduction without considering the impact on quality control would be professionally unacceptable. This failure stems from a disregard for regulatory requirements that mandate specific quality control procedures to ensure test accuracy and reliability. Such an approach risks compromising patient safety by potentially allowing inaccurate results to go undetected, leading to significant ethical and legal ramifications. Another incorrect approach that relies on anecdotal evidence or infrequent, unsystematic checks of quality control data is also professionally unacceptable. This method fails to meet the systematic and documented requirements of quality assurance programs. Regulatory bodies expect documented evidence of ongoing quality control monitoring and corrective actions. The absence of such documentation indicates a failure to comply with established standards and a lack of commitment to maintaining a high level of laboratory performance. A third incorrect approach that delegates quality control responsibilities to untrained personnel without adequate supervision or validation of their competency is professionally unacceptable. This violates principles of personnel competency and oversight, which are critical components of laboratory quality management systems. Regulatory agencies require that all personnel involved in testing and quality control are adequately trained, qualified, and demonstrate competency in their assigned tasks. The professional decision-making process for similar situations should involve a thorough understanding of relevant regulatory frameworks, e.g., CLIA, CAP guidelines, a commitment to patient safety as the paramount concern, and a systematic approach to quality management. This includes 1. Identifying all applicable regulatory requirements for quality control and assurance. 2. Assessing current laboratory practices against these requirements. 3. Developing and implementing policies and procedures that ensure compliance and optimize test result reliability. 4. Regularly reviewing and updating quality assurance programs based on performance data, regulatory changes, and technological advancements. 5. Ensuring adequate training and competency assessment for all laboratory personnel involved in quality control. Question 8. Process analysis reveals that technologists performing a quantitative analysis of a patient sample using high-performance liquid chromatography, HPLC, observes a result that falls outside the established acceptable range for the associated quality control, QC materials, despite the QC materials themselves appearing to be within their expected limits when initially analyzed. Technologist is aware that the patient's clinical presentation suggests a result within the expected range. What is the most appropriate course of action? Option A. Discard the patient sample and request a new specimen collection immediately without further investigation of the current analytical run. Option B. Initiate a thorough investigation into the HPLC system, including rerunning QC samples, verifying instrument calibration and maintenance, checking reagent integrity, and reanalyzing the patient sample to identify the source of the discrepancy before reporting any results. Option C. Reanalyze the patient sample and the QC materials using a different HPLC column and mobile phase to rule out method-specific issues. Option D. Immediately report the patient's HPLC result as obtained, assuming the QC materials were within limits and the patient's clinical picture supports this value. The correct answer is D. Immediately report the patient's HPLC result as obtained, assuming the QC materials were within limits and the patient's clinical picture supports this value. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a potential discrepancy in analytical results obtained via HPLC, which could have significant implications for patient care and laboratory quality. The technologist is faced with a conflict between a preliminary finding and the established quality control, QC parameters. The ethical dilemma arises from the responsibility to report accurate results while also adhering to established protocols and the potential consequences of reporting a result that may be erroneous or misleading. Navigating this requires a balance of technical expertise, adherence to regulatory guidelines, and professional integrity. Correct approach analysis. The correct approach involves meticulously investigating the HPLC system and the analytical process to identify the root cause of the discrepancy. This includes rerunning QC samples, checking instrument calibration and maintenance logs, verifying reagent integrity, and potentially reanalyzing the patient sample. This systematic investigation aligns with the principles of good laboratory practice, GLP, and the CLIA 88 regulations, assuming U.S. jurisdiction for ABCC. CLIA mandates that laboratories establish and follow written procedures for specimen handling, instrument calibration, QC, and corrective actions when QC is out of limits. The College of American Pathologists, CAP, accreditation standards, which are often used to demonstrate CLIA compliance, also emphasize thorough investigation of QC failures and analytical discrepancies before reporting patient results. This approach ensures patient safety by preventing the reporting of potentially inaccurate data and upholds the laboratory's commitment to quality. Incorrect approaches analysis. Reporting the initial patient result without further investigation is professionally unacceptable because it violates the fundamental principle of reporting accurate and reliable patient data. This directly contravenes CLIA regulations that require QC to be performed and acceptable before reporting patient results. It also fails to meet the standards of professional practice, which demand a thorough investigation of any analytical deviation. Immediately discarding the patient sample and recollecting without a documented investigation is also problematic. While recollection might be necessary, doing so without first attempting to understand the analytical issue could lead to unnecessary patient inconvenience and cost. Furthermore, it bypasses the required investigative steps mandated by regulatory bodies to identify and rectify analytical problems within the existing sample or process. Assuming the discrepancy is due to a transient instrument fluctuation and proceeding with reporting the initial result without verification is a failure to adhere to QC principles. CLIA and CAP require that any deviation from expected QC performance be investigated and resolved. This approach prioritizes expediency over accuracy and potentially compromises patient care by reporting a result that has not been validated. Professional reasoning. Professionals should approach such situations by first recognizing the importance of QC data as an indicator of analytical system performance. The decision-making process should involve a systematic, protocol-driven investigation. This includes consulting laboratory SOPs for handling QC failures and analytical discrepancies, reviewing instrument logs, checking reagent expiry and preparation, and performing confirmatory tests. If the discrepancy cannot be resolved through these steps, the laboratory director or designated supervisor must be consulted, and a decision made regarding the reporting of patient results, potentially including recollection of the specimen. This structured approach ensures compliance with regulatory requirements and upholds the highest standards of patient care. Question 9. Quality control measures reveal a consistent upward drift in absorbance readings for a specific UV-Vis spectrophotometric assay over the past week. The drift is observed across multiple QC levels and patient samples. Which of the following represents the most appropriate initial corrective action? Option A. Immediately recalibrate the spectrophotometer using fresh calibration standards. Option B. Adjust the calibration curve to account for the observed drift in absorbance values. Option C. Replace the deuterium lamp in the spectrophotometer as it is nearing its expected lifespan. Option D. Verify the integrity and expiration date of the reagent lot in use and ensure proper storage conditions have been maintained. The correct answer is D. Verify the integrity and expiration date of the reagent lot in use and ensure proper storage conditions have been maintained. Explanation. This scenario presents a common challenge in clinical chemistry laboratories, identifying and rectifying deviations in analytical performance that could impact patient care. The professional challenge lies in accurately diagnosing the root cause of the observed absorbance drift in UV-Vis spectrophotometry and implementing the most effective and compliant corrective action. This requires a thorough understanding of instrument principles, reagent stability, and regulatory expectations for quality assurance. The correct approach represents best professional practice because it systematically investigates potential sources of error in a logical sequence, prioritizing factors most likely to cause a consistent drift. Adhering to CLIA, Clinical Laboratory Improvement Amendments, regulations, specifically those pertaining to quality control and corrective action, is paramount. CLIA mandates that laboratories establish and follow written policies and procedures for quality control, including actions to be taken when results are unsatisfactory. A systematic investigation ensures that the corrective action addresses the actual problem, preventing recurrence and maintaining the accuracy and reliability of patient test results. This aligns with the ethical obligation to provide accurate diagnostic information. An incorrect approach that immediately recalibrates the instrument without investigating the cause is professionally unacceptable. This bypasses the critical step of identifying the underlying issue, which could be a more fundamental problem with the reagent, cuvette integrity, or even a systematic instrument malfunction that recalibration alone might not resolve. This failure to investigate violates CLIA requirements for root cause analysis when QC failures occur and could lead to a false sense of security while the underlying problem persists. Another incorrect approach, such as simply replacing the lamp, is also professionally unacceptable if it's not the most probable cause. While lamp degradation can affect UV-Vis performance, a consistent drift might point to other issues. Acting on a less likely cause without a systematic investigation risks wasting resources and delaying the identification of the true problem. This demonstrates a lack of methodical problem solving and potentially a failure to adhere to CLIA expectation of a thorough and documented corrective action process. Finally, an approach that involves adjusting the calibration curve without understanding the cause of the drift is a significant regulatory and ethical failure. Calibration adjustments should only be made after a problem has been identified and corrected, or as part of a routine recalibration process. Making such adjustments to compensate for a drift without investigation is essentially masking a problem, which directly compromises the accuracy of patient results and violates the fundamental principles of laboratory quality assurance mandated by CLIA. The professional reasoning process for similar situations should involve a structured approach. 1. Acknowledge and document the QC deviation. 2. Consult instrument manuals and laboratory SOPs for troubleshooting guidance. 3. Systematically evaluate potential causes, starting with the most probable and easiest to verify, e.g., reagent integrity, cuvette cleanliness, sample handling. 4. Implement targeted corrective actions based on the investigation. 5. Rerun QC to confirm resolution. 6. Document all steps taken, findings, and the final resolution. 7. If the problem persists, escalate to more complex troubleshooting or instrument service. Question 10. The efficiency study reveals that a new amperometric method for glucose measurement offers significantly faster turnaround times and lower reagent costs compared to the current photometric assay. However, preliminary data also indicates a slight increase in the coefficient of variation, CV, for low-concentration samples. Considering the regulatory framework governing clinical laboratories in the United States, what is the most critical next step in evaluating this amperometric method for potential adoption? Option A. Focus solely on optimizing the reagent formulation to reduce the CV at low concentrations, without further analytical validation or consideration of other performance metrics. Option B. Rely on the manufacturer's published performance data and validation reports to justify the adoption of the new amperometric method. Option C. Conduct a comprehensive analytical validation study, including assessment of accuracy, precision across the clinically relevant range, linearity, detection limits, and interference studies, to ensure compliance with CLIA 88 performance standards. Option D. Immediately implement the new amperometric method due to its cost and speed advantages, assuming the slight increase in CV is within acceptable limits for routine clinical practice. Correct answer is C. Conduct a comprehensive analytical validation study, including assessment of accuracy, precision across the clinically relevant range, linearity, detection limits, and interference studies, to ensure compliance with CLIA 88 performance standards. Explanation: scenario analysis. This scenario presents a common challenge in clinical chemistry where a new analytical method, amperometry-based, is being evaluated for its efficiency and reliability. The professional challenge lies in ensuring that the chosen method meets stringent performance standards and regulatory requirements for patient care, while also considering practical implementation factors. The need for careful judgment arises from balancing the potential benefits of a new technology with the imperative to maintain accuracy, precision, and compliance with established guidelines. Correct approach analysis. The correct approach involves a comprehensive evaluation that includes not only the analytical performance characteristics of the amperometric method, but also its alignment with CLIA 88 regulations. CLIA mandates specific quality control, proficiency testing, and method validation procedures to ensure the accuracy and reliability of laboratory testing. Therefore, verifying that the amperometric method meets these regulatory benchmarks, alongside its analytical performance, is paramount for its adoption and ensures patient safety and quality of care. This aligns with the apt focus on competent application of clinical chemistry principles within a regulated environment. Incorrect approaches analysis. One incorrect approach would be to solely focus on the speed and cost-effectiveness of the amperometric method, without rigorous validation against established performance standards and regulatory requirements. This overlooks the fundamental CLIA 88 mandate that all laboratory tests must be accurate, reliable, and performed under a quality system. Prioritizing speed and cost over analytical validity and regulatory compliance poses a significant risk to patient diagnosis and treatment, representing a failure in professional responsibility and regulatory adherence. Another incorrect approach would be to implement the amperometric method based on manufacturer claims alone, without independent verification of its performance characteristics in the specific laboratory setting. CLIA 88 requires laboratories to validate all new methods to ensure they perform as expected in their environment. Relying solely on external claims without internal validation can lead to inaccurate results and noncompliance, as the laboratory cannot attest to the method's suitability for its patient population and workflow. This demonstrates a lack of due diligence and a failure to uphold the laboratory's responsibility for test accuracy. A third incorrect approach would be to adopt the amperometric method without considering the necessary training and competency assessment for laboratory personnel. CLIA 88 emphasizes the importance of qualified personnel performing laboratory tests. Implementing a new technology without ensuring staff are adequately trained and competent to operate and troubleshoot it can lead to errors and compromised patient care. This represents a failure in the laboratory's quality management system and a disregard for regulatory requirements concerning personnel qualifications. Professional reasoning. professionals should approach the evaluation of new analytical methods with a systematic, evidence-based process. This involves 1. Understanding the analytical principles of the new technology, amperometry in this case, and its potential advantages and limitations. 2. Conducting thorough analytical validation studies, accuracy, precision, linearity detection limits, interference studies, according to established guidelines e.g. CLSI. 3. Critically assessing the method's performance against regulatory requirements, specifically CLIA 88 for U.S.-based laboratories, ensuring all quality system essentials are met. 4. Evaluating the practical aspects, including cost, workflow integration, and personnel training needs. 5. Making a data-driven decision based on the comprehensive evaluation, prioritizing patient safety and regulatory compliance above all else. Question 11. Operational review demonstrates that a new automated immunoassay analyzer offers significantly faster turnaround times and a broader menu of esoteric tests compared to the current system. Before recommending its adoption, what is the most critical regulatory and analytical consideration to ensure patient safety and laboratory compliance with U.S. federal regulations? Option A. Comprehensive analytical validation and verification of the new analyzer's performance characteristics, including accuracy, precision, linearity, and interference studies, in accordance with CLIA and CAP guidelines. Option B. A detailed cost-benefit analysis comparing the capital expenditure and reagent costs of the new analyzer against the existing system. Option C. A review of the manufacturer's marketing materials and promotional literature to highlight the advanced features and potential for increased test volume. Option D. A preliminary assessment of potential space requirements and minor modifications needed for the laboratory's physical infrastructure. The correct answer is A. Comprehensive analytical validation and verification of the new analyzer's performance characteristics, including accuracy, precision, linearity, and interference studies, in accordance with CLIA and CAP guidelines. Explanation: Scenario analysis. This scenario presents a common challenge in clinical chemistry where a new analytical technique is being considered for implementation. The professional challenge lies in ensuring that the chosen method not only meets analytical performance requirements, but also complies with all relevant regulatory standards for patient safety and quality of care, as mandated by the American Board of Clinical Chemistry (ABCC) certification framework. The decision requires a thorough risk assessment that balances innovation with established guidelines. Correct approach analysis. The correct approach involves a comprehensive evaluation of the new analytical technique's performance characteristics against established CLIA, Clinical Laboratory Improvement Amendments, regulations, and CAP, College of American Pathologists, accreditation standards, which are implicitly followed by ABCC-certified professionals. This includes assessing accuracy, precision, linearity, detection limits, and interference studies, as well as evaluating the manufacturer's validation data and the laboratory's own verification protocols. Furthermore, it necessitates a review of the impact on workflow, personnel training, and the potential for improved patient outcomes or diagnostic capabilities. This holistic approach ensures that the new method is analytically sound, clinically relevant, and compliant with all applicable U.S. federal and professional guidelines governing laboratory testing. Correct approach is analysis. One incorrect approach would be to prioritize cost savings or speed of analysis above all other factors. This fails to meet regulatory requirements because CLIA mandates that laboratory tests must be accurate, reliable, and provide timely results in a manner that is responsible and promotes the public good. Overlooking analytical performance or validation would directly violate these principles and could lead to erroneous patient results, jeopardizing patient safety. Another incorrect approach would be to adopt the new technique based solely on peer-reviewed literature without independent laboratory verification. The literature is valuable. CLIA and CAP require laboratories to perform their own validation or verification of analytical methods before implementation. Relying solely on external data bypasses the essential step of ensuring the method performs as expected within the specific laboratory environment and with the laboratory's own reagents and equipment, thus failing to meet quality assurance mandates. A third incorrect approach would be to implement the new technique without adequate staff training or competency assessment. Regulatory bodies like CLIA and CAP emphasize the importance of qualified personnel. Implementing a new method without ensuring that staff are properly trained and competent to operate the instrument perform the tests, and interpret the results poses a significant risk of errors and noncompliance with personnel qualifications and quality control requirements. Professional reasoning. Professionals should approach the implementation of new analytical techniques with a systematic, risk-based methodology. This involves 1. Clearly defining the clinical need and analytical requirements for the test. 2. Thoroughly reviewing available literature and manufacturer data. 3. Conducting comprehensive analytical validation and verification studies according to CLIA and CAP guidelines. 4. Assessing the impact on laboratory workflow, staffing, and budget. 5. Developing robust quality control and proficiency testing plans. 6. Ensuring adequate staff training and competency assessment. 7. Documenting all validation and implementation steps for regulatory compliance and future reference. This structured process ensures that decisions are evidence-based, compliant, and ultimately focused on providing accurate and reliable patient care. Question 12. Stakeholder feedback indicates a consistent pattern of unexpected, low results for a specific analyte in a subset of patient samples processed by the clinical chemistry laboratory. These discrepancies are noted primarily in samples from patients undergoing a particular therapeutic regimen. The laboratory director is tasked with addressing this issue promptly to ensure accurate patient care. Which of the following represents the most appropriate initial course of action? Option A. Immediately release the low results to clinicians, as the therapeutic regimen may be influencing the analyte levels. Option B. Initiate a comprehensive investigation into the analytical process, including a review of reagent lot numbers, instrument calibration and maintenance logs, potential interfering substances related to the therapeutic regimen, and sample handling procedures. Option C. Discard the discrepant samples and request new samples from the affected patients for retesting without further investigation into the cause of the initial discrepancies. Option D. Advise clinicians to discontinue the specific therapeutic regimen until the laboratory can resolve the analytical discrepancies. Correct answer is A. Immediately release the low results to clinicians, as the therapeutic regimen may be influencing the analyte levels. Explanation. This scenario presents a professional challenge due to the inherent tension between rapid diagnostic turnaround and the imperative for rigorous quality control in clinical chemistry. The laboratory director must balance the urgent clinical need for test results with the ethical and regulatory obligation to ensure the accuracy and reliability of those results. This requires a deep understanding of the analytical principles, potential interferences, and the regulatory framework governing laboratory practice. The correct approach represents best professional practice because it prioritizes patient safety and the integrity of diagnostic information. By initiating a thorough investigation into the discrepant results, including a review of the analytical methodology, reagent quality, instrument calibration, and patient-specific factors, the laboratory director adheres to the principles of good laboratory practice, GLP, and the requirements of the American Board of Clinical Chemistry, ABCC certification standards, which emphasize accuracy, precision, and the validation of analytical methods. This systematic approach ensures that any identified issues are addressed comprehensively, preventing the release of potentially erroneous data that could lead to misdiagnosis or inappropriate patient management. An incorrect approach that involves immediately releasing the results without further investigation fails to uphold the fundamental ethical responsibility of the clinical chemist to provide accurate and reliable data. This bypasses critical quality control measures and violates the implicit trust placed in the laboratory by clinicians and patients. Releasing unverified results can lead to significant patient harm, including delayed or incorrect treatment, and constitutes a failure to comply with regulatory expectations for laboratory quality assurance. Another incorrect approach, such as solely blaming the instrument without a systematic investigation, is also professionally unacceptable. While instrument malfunction is a possibility, it is only one of many potential sources of error. A comprehensive review must consider all aspects of the analytical process, from sample collection and handling to data interpretation. Focusing on a single potential cause prematurely can lead to overlooking other critical issues and may result in an incomplete or ineffective corrective action. This approach lacks the systematic problem-solving required by professional standards. Finally, an approach that involves discarding the discrepant samples and retesting without documenting the investigation and its findings is a failure in record-keeping and quality assurance. Regulatory bodies, including those relevant to ABCC certification, mandate thorough documentation of all quality control activities, investigations, and corrective actions. This documentation is crucial for demonstrating compliance, identifying trends, and facilitating continuous improvement. Without proper documentation, the laboratory cannot effectively track its performance or provide evidence of its commitment to quality. The professional decision-making process for similar situations should involve a structured approach to problem solving. This includes 1. Recognizing and acknowledging the discrepancy. 2. Initiating a systematic investigation that considers all potential sources of error. 3. Consulting relevant literature and expert resources. 4. Implementing corrective actions based on the investigation's findings. 5. Documenting all steps taken and their outcomes. And 6. Communicating findings and actions to relevant stakeholders. This process ensures that patient care is not compromised by analytical errors and that the laboratory operates in accordance with the highest professional and regulatory standards. Question 13. The control framework reveals a consistent trend of increased variability in the conductometric measurement of a critical electrolyte, impacting the precision of patient results. Which approach best addresses this issue while adhering to the principles of quality assurance and regulatory compliance expected for ABCC certification? Option A. Implement a new, unvalidated control material that exhibits a narrower range of acceptable values, hoping it will force the system into better performance. Option B. Conduct a thorough review of reagent lot performance, instrument calibration records, and pre-analytical sample handling procedures to identify potential sources of variability, followed by targeted corrective actions and revalidation. Option C. Rely on the historical performance data of the conductometric assay and assume the current variability is within acceptable, albeit wider, limits for routine clinical reporting. Option D. Immediately adjust the instrument's gain settings to compensate for the observed variability, assuming a minor drift in electronic components. The correct answer is B. Conduct a thorough review of reagent lot performance, instrument calibration records, and pre-analytical sample handling procedures to identify potential sources of variability, followed by targeted corrective actions and revalidation. Explanation. The control framework reveals a need to optimize the conductometric measurement of a critical analyte in a clinical laboratory setting, specifically within the context of the American Board of Clinical Chemistry, ABCC, certification requirements. This scenario is professionally challenging because it requires balancing analytical performance with regulatory compliance and patient safety. The ABCC certification emphasizes a deep understanding of laboratory principles, quality control, and regulatory adherence, all of which are paramount in ensuring accurate and reliable diagnostic testing. The correct approach represents best professional practice because it directly addresses the identified issue through a systematic, evidence-based methodology that aligns with CLIA 88 regulations and ABCC emphasis on quality assurance. This involves a comprehensive review of the analytical process, including reagent quality, instrument calibration, and pre-analytical variables, followed by targeted adjustments and rigorous validation. This methodical approach ensures that any changes implemented are effective, reproducible, and do not compromise the accuracy or reliability of the test results, thereby upholding the highest standards of patient care and regulatory compliance. An incorrect approach that focuses solely on adjusting instrument parameters without investigating the root cause of the variability is professionally unacceptable. This fails to adhere to the principles of good laboratory practice mandated by CLIA 88, which requires laboratories to establish and follow written procedures for all tests performed. Such an approach risks masking underlying problems, leading to persistent inaccuracies and potentially erroneous patient results. It also demonstrates a lack of thoroughness and a failure to apply scientific principles to problem solving, which are core competencies expected of ABCC-certified professionals. Another incorrect approach that involves implementing changes based on anecdotal evidence or without proper validation is also professionally unacceptable. This bypasses the critical steps of quality control and quality assurance required by CLIA 88. Without systematic validation, the laboratory cannot be assured that the changes have indeed optimized the process or that they haven't introduced new sources of error. This disregard for established validation protocols represents a significant ethical and regulatory failure, as it compromises the integrity of the laboratory's testing services and potentially endangers patient safety. The professional decision-making process for similar situation should involve a structured approach. 1. Identify and clearly define the problem. 2. Review existing standard operating procedures, SOP, and relevant regulatory guidelines, e.g., CLIA 88. 3. Formulate hypotheses regarding potential causes of the observed issue. 4. Design and execute experiments or investigations to test these hypotheses, prioritizing systematic evaluation of reagents, instruments, and pre-analytical factors. 5. Implement changes based on data and evidence, followed by thorough validation and re-evaluation of performance metrics. 6. Document all steps, findings, and decisions meticulously. 7. Continuously monitor performance to ensure sustained optimization and compliance. Question 14. Market research demonstrates that a new fluorescent spectrophotometry assay for a critical diagnostic marker offers potential improvements in sensitivity and turnaround time. As the clinical laboratory director, you are tasked with evaluating the risks associated with implementing this new assay. Which of the following approaches represents the most appropriate risk assessment strategy to ensure patient safety and regulatory compliance? Option A. Conduct a comprehensive analytical validation of the new assay within the laboratory, including linearity, accuracy, precision, and interference studies, and compare results to established benchmarks in the laboratory's proficiency testing program. Option B. Implement the new assay and rely on anecdotal feedback from technologists regarding its performance, without conducting formal validation studies. Option C. Immediately implement the new assay based on the manufacturer's provided validation data, assuming it meets acceptable performance standards for clinical use. Option D. Prioritize the cost savings and reduced turnaround time offered by the new assay, deferring a full analytical validation until after the assay has been in routine use for several months. The correct answer is A. Conduct a comprehensive analytical validation of the new assay within the laboratory, including linearity, accuracy, precision, and interference studies, and compare results to established benchmarks in the laboratory's proficiency testing program. Explanation. Scenario analysis. This scenario presents a professional challenge related to the implementation of a new fluorescent spectrophotometry assay for a critical diagnostic marker. The challenge lies in balancing the need for rapid adoption of potentially improved technology with the imperative to ensure patient safety and regulatory compliance. The clinical laboratory director must critically evaluate the proposed risk mitigation strategies, considering their effectiveness in preventing erroneous patient results and their alignment with established regulatory standards for laboratory testing. Correct approach analysis. The correct approach involves a comprehensive risk assessment that prioritizes validation of the new assay's analytical performance against established benchmarks and regulatory requirements. This includes rigorous verification of linearity, accuracy, precision, and interference studies, as mandated by CLIA, Clinical Laboratory Improvement Amendments, regulations for laboratory test complexity and performance. Furthermore, it necessitates a thorough review of the manufacturer's validation data and the laboratory's own proficiency testing (PT) program to ensure ongoing quality and comparability to reference methods. This systematic approach ensures that the new assay is analytically sound and that patient results will be reliable, thereby upholding the ethical obligation to provide accurate diagnostic information and complying with CLIA quality system requirements. Incorrect approach is analysis. One incorrect approach involves relying solely on the manufacturer's validation data without independent laboratory verification. This fails to meet CLIA requirement for laboratory-specific validation of new tests, as instrument performance and reagent lot variations can impact results. Ethically, this bypasses the laboratory's responsibility to ensure the accuracy and reliability of tests performed under its own CLIA certificate. Another incorrect approach is to implement the new assay immediately based on anecdotal evidence of improved sensitivity, without conducting any formal risk assessment or validation. This directly violates CLIA regulations regarding test validation and quality control, creating a significant risk of reporting inaccurate patient results. Ethically, this prioritizes expediency over patient safety and the integrity of diagnostic information. A third incorrect approach is to focus exclusively on cost savings associated with the new assay, deferring comprehensive analytical validation until after implementation. This represents a failure to adhere to CLIA quality system requirements, which mandate that all tests must be analytically validated before patient reporting. The ethical failure lies in potentially compromising patient care for financial gain, a clear breach of professional responsibility. Professional reasoning. When faced with the introduction of new technology like fluorescent spectrophotometry, laboratory professionals must adopt a structured, risk-based approach. This involves 1. Identifying potential risks to patient safety and result accuracy. 2. Evaluating the likelihood and impact of these risks. 3. Implementing appropriate control measures, which in this context means rigorous analytical validation. 4. Monitoring the effectiveness of these controls through ongoing quality assurance activities, including proficiency testing. This systematic process, grounded in regulatory requirements like CLIA and ethical principles of patient welfare, ensures that technological advancements enhance, rather than compromise, the quality of laboratory services. Question 15. Strategic planning requires a clinical laboratory to anticipate and address potential ethical and regulatory challenges. A physician calls the laboratory to report a critical value for a patient, but then immediately requests that the result not be communicated to the patient's primary care physician at this time, stating they have a specific, non-emergent reason for delaying the notification. The laboratory professional is aware of the laboratory's established critical value policy, which mandates immediate notification to the ordering physician. What is the most appropriate course of action for the laboratory professional? Option A. Report the critical value to a different member of the patient's care team, such as a charge nurse, instead of the ordering physician. Option B. Comply with the physician's request and withhold the critical value from the ordering physician. Option C. Adhere to the laboratory's critical value policy and report the result to the ordering physician as per protocol. Option D. Refuse to report the critical value, citing the physician's direct instruction. The correct answer is C. Adhere to the laboratory's critical value policy and report the result to the ordering physician as per protocol. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between a laboratory's established protocols for reporting critical values and a physician's request to withhold information due to patient-specific circumstances. The laboratory professional must balance the imperative to adhere to regulatory requirements for patient safety with the physician's stated intent to manage patient care in a particular manner. This requires careful judgment to ensure that patient well-being is prioritized while maintaining professional integrity and compliance. Correct approach analysis. The correct approach involves adhering to the laboratory's established critical value policy, which is designed to ensure timely notification of potentially life-threatening results to the responsible clinician. This policy is typically grounded in regulatory requirements, e.g., CLIA regulations in the U.S., that mandate reporting of critical values to protect patient safety. By following the policy, the laboratory professional upholds their ethical and regulatory obligations to communicate critical information promptly, thereby enabling the physician to intervene appropriately. This action represents best professional practice as it prioritizes patient safety above all else, aligning with the core mission of clinical laboratory science. Incorrect approaches analysis. One incorrect approach would be to immediately comply with the physician's request to withhold the critical value. This action would represent a significant regulatory failure, as it directly violates the laboratory's critical value policy and potentially CLIA regulations that mandate reporting. Ethically, it would be a dereliction of duty to patient safety, as the physician's rationale, while potentially well-intentioned, does not supersede the established protocol for critical results. Another incorrect approach would be to report the critical value to a nurse or other ancillary staff member instead of the ordering physician, without confirming that this is an acceptable alternative reporting pathway within the institution's policy. While the intent might be to ensure the information reaches the care team, bypassing the designated reporting channel could lead to miscommunication or delays, and may not fulfill the regulatory requirement of notifying the responsible clinician. A third incorrect approach would be to refuse to report the critical value altogether, citing the physician's request without further investigation or escalation. This demonstrates a lack of understanding of the critical value policy and the underlying regulatory and ethical imperatives. It fails to engage in professional problem solving and instead creates an impasse that could jeopardize patient care. Professional reasoning. In situations involving critical values and physician requests that deviate from policy, a professional decision-making process should involve 1. understanding and clearly recalling the laboratory's critical value policy and its regulatory basis. 2. Directly communicating with the ordering physician to understand their concerns and rationale for the request. 3. Reaffirming the laboratory's policy and the rationale for critical value reporting, emphasizing patient safety. 4. If the physician persists, escalating the issue to laboratory management or the designated patient safety officer to ensure appropriate institutional oversight and resolution. This structured approach ensures that patient safety remains paramount while fostering professional communication and adherence to regulatory standards. Question 16. Governance review demonstrates a consistent, albeit slight, upward trend in the mean absorbance values for a critical enzyme-linked immunosorbent assay, ELISA, used for monitoring therapeutic drug levels over the past 6 months. This trend, while not yet exceeding established upper control limits, represents a departure from the assay's historical performance profile. The laboratory director is seeking the most appropriate course of action to ensure continued analytical accuracy and patient safety. Option A. Initiate a comprehensive investigation into potential root causes, including reagent lot variability, instrument performance, and environmental factors, and implement corrective actions based on findings. Option B. Accept the observed trend as within acceptable variability and continue routine monitoring without further action. Option C. Immediately discontinue the current ELISA method and transition to an alternative assay to avoid potential future issues. Option D. Attribute the trend solely to the most recent reagent lot change and request a new lot from the manufacturer without further investigation. The correct answer is A. Initiate a comprehensive investigation into potential root causes, including reagent lot variability, instrument performance, and environmental factors, and implement corrective actions based on findings. Explanation. This scenario presents a common implementation challenge in clinical chemistry laboratories, ensuring the continued accuracy and reliability of a widely used diagnostic assay, the ELISA, in the face of evolving scientific understanding and potential for drift in performance. The challenge lies in balancing the need for consistent patient care with the imperative to adopt best practices and adhere to regulatory expectations for quality assurance. Careful judgment is required to select the most appropriate course of action that upholds patient safety and regulatory compliance without causing undue disruption. The correct approach represents best professional practice because it directly addresses the observed performance deviation through a systematic, evidence-based investigation. This aligns with the fundamental principles of laboratory quality management systems, which are mandated by regulatory bodies like the College of American Pathologists, CAP, and the Centers for Medicare and Medicaid Services, CMS, through clear regulations in the United States. Specifically, investigating the root cause of the observed shift in ELISA performance, including reagent lot variability, instrument calibration, and potential environmental factors, is a core requirement of quality control and proficiency testing programs. This proactive and thorough investigation ensures that any underlying issues are identified and corrected before they significantly impact patient results, thereby maintaining the integrity of diagnostic information and patient care. It also demonstrates adherence to the ABCC emphasis on analytical quality and the responsible implementation of laboratory testing. An incorrect approach that involves simply accepting the observed shift without investigation fails to meet regulatory requirements for quality assurance. Clear regulations, for example, mandate that laboratories must investigate and resolve any deviations from expected performance. Ignoring such deviations constitutes a failure to maintain a robust quality management system and could lead to the reporting of inaccurate patient results, posing a direct risk to patient safety. This also violates the ethical obligation of a clinical chemist to ensure the accuracy and reliability of laboratory testing. Another incorrect approach, such as immediately discontinuing the assay without a thorough investigation, is also professionally unacceptable. While assay performance issues warrant attention, a premature discontinuation without understanding the root cause can lead to unnecessary disruption in patient care, increased costs associated with implementing a new assay, and potential delays in diagnosis and treatment. It bypasses the systematic problem-solving expected in a regulated laboratory environment and does not demonstrate due diligence in addressing the observed performance drift. A third incorrect approach, such as attributing the shift solely to a new reagent lot without confirming this through further testing and comparison, is an incomplete investigation. While reagent lot changes are a common cause of assay variability, other factors can contribute. A responsible professional must conduct a comprehensive evaluation to pinpoint the definitive cause, rather than making assumptions. This incomplete investigation risks failing to identify other contributing factors or incorrectly blaming a reagent lot, leading to potential future issues if the true root cause remains unaddressed. The professional reasoning process for similar situations should involve a systematic approach to quality management. When performance deviations are observed, the first step is to acknowledge the deviation and initiate a formal investigation. This investigation should follow a defined protocol, starting with reviewing quality control data, proficiency testing results, and any recent changes in reagents, instruments, or procedures. The goal is to identify the root cause through a process of elimination and evidence gathering. Once the cause is identified, appropriate corrective actions must be implemented and validated to ensure the issue is resolved. Documentation of the entire process, from initial observation to final resolution, is critical for regulatory compliance and continuous quality improvement. Question 17. Assessment of a new analytical method for serum creatinine, proposed by a laboratory director, requires a decision on its implementation. The director has reviewed the manufacturer's specifications, which claim superior precision and a lower limit of detection compared to the current method. The laboratory has a history of excellent performance with the existing method, and there are no immediate clinical concerns regarding its accuracy. The proposed new method is also less expensive per test. What is the most appropriate course of action for the laboratory to ensure analytical quality and regulatory compliance? Option A. Proceed with adopting the new method based on its lower cost per test, as cost savings are a primary driver for laboratory efficiency and improvement. Option B. Utilize the new method for a limited number of patient samples and compare the results to the current method only if significant discrepancies are observed, to minimize initial validation effort. Option C. Implement the new method immediately due to its claimed superior precision and lower cost, assuming the manufacturer's specifications are accurate and sufficient for clinical needs. Option D. Conduct a comprehensive analytical validation of the new method in the laboratory, including comparison studies with the current method, to confirm manufacturer claims and assess its suitability for routine use before implementation. The correct answer is D. Conduct a comprehensive analytical validation of the new method in the laboratory, including comparison studies with the current method, to confirm manufacturer claims and assess its suitability for routine use before implementation. Explanation. Scenario analysis. This scenario presents a common challenge in clinical chemistry, where a laboratory must decide whether to implement a new analytical method for a critical analyte. The challenge lies in balancing the potential benefits of improved accuracy, precision, or efficiency against the risks of introducing errors, impacting patient care, and incurring significant costs. Ensuring compliance with regulatory requirements for method validation and implementation is paramount. Correct approach analysis. The correct approach involves a systematic, evidence-based evaluation of the new method against established performance criteria and regulatory guidelines. This includes rigorous analytical validation, comparison with the existing method, and assessment of its impact on clinical decision-making. This aligns with the principles of quality assurance and patient safety mandated by the American Board of Clinical Chemistry (ABCC) and relevant U.S. regulatory bodies e.g., CLIA. The process ensures that any new method is reliable, accurate, and suitable for its intended use, thereby upholding the highest standards of clinical laboratory practice and patient care. Incorrect approaches analysis. Implementing the new method solely based on vendor claims without independent validation is a significant regulatory and ethical failure. This bypasses the requirement for laboratories to verify that a method performs as expected within their specific environment, potentially leading to inaccurate results and compromised patient care. It violates the principles of good laboratory practice and the spirit of regulatory oversight designed to ensure analytical quality. Adopting the new method without comparing its performance to the current method is also professionally unacceptable. This lack of comparative data prevents a thorough assessment of whether the new method offers a genuine improvement or introduces new biases. It hinders informed decision-making regarding method selection and can lead to the adoption of a suboptimal or even detrimental analytical process, failing to meet the standard of care. Choosing the new method based primarily on cost reduction without adequate consideration of analytical performance and clinical impact is a critical error. While cost-effectiveness is a factor, it must not supersede the primary responsibility of ensuring accurate and reliable patient testing. Prioritizing cost over analytical integrity can lead to diagnostic errors, inappropriate treatment, and ultimately, harm to patients, representing a failure to adhere to ethical and regulatory obligations. Professional reasoning. Professionals should employ a structured decision-making framework that prioritizes patient safety and regulatory compliance. This framework involves 1. Defining the clinical need and performance requirements for the analyte. 2. Conducting a thorough literature review and evaluating vendor data. 3. Performing comprehensive analytical validation of the new method in-house, including accuracy, precision, linearity detection limits, interference studies, and comparison with the existing method. 4. Assessing the clinical impact of any observed differences. 5. Documenting all validation data and decisions. 6. Obtaining necessary approvals and ensuring staff training. 7. Implementing a robust quality control program for the new method. Question 18. Comparative studies suggest that while chemiluminescent immunoassays (CLIA) offer significant advantages in sensitivity and speed for detecting various analytes, their implementation in a clinical laboratory setting requires rigorous adherence to specific regulatory mandates to ensure accurate and reliable patient results. Considering the U.S. regulatory framework for clinical laboratories, which of the following represents the most appropriate approach for a laboratory to ensure the continued analytical performance of a newly implemented CLIA method for a critical diagnostic marker? Option A. Conduct a single, limited validation study focusing only on the assay's precision, as this is the most critical performance metric for immunoassays. Option B. Independently verify all critical performance characteristics of the CLIA method, including accuracy, precision, linearity, and analytical sensitivity, against established laboratory-specific performance specifications and regulatory requirements before routine patient testing. Option C. Implement the CLIA method for routine patient testing immediately upon receipt, with the understanding that the manufacturer's quality control materials will suffice for ongoing monitoring. Option D. Rely solely on the performance data provided by the CLIA assay manufacturer, assuming it meets all necessary quality standards for clinical use. The correct answer is B. Independently verify all critical performance characteristics of the CLIA method, including accuracy, precision, linearity, and analytical sensitivity, against established laboratory-specific performance specifications and regulatory requirements before routine patient testing. Explanation. Scenario analysis. This scenario presents a common challenge in clinical chemistry laboratories, ensuring the continued accuracy and reliability of analytical methods, particularly those employing sensitive technologies like chemiluminescent immunoassays (CLIA. The professional challenge lies in balancing the need for efficient laboratory operations with the absolute requirement for patient safety and regulatory compliance. CLIA, while offering high sensitivity and specificity, are susceptible to various factors that can impact performance, including reagent degradation, instrument drift, and environmental influences. Therefore, a systematic and evidence-based approach to method validation and ongoing quality control is paramount. The ABCC certification emphasizes a deep understanding of these principles within the U.S. regulatory framework. Correct approach analysis. The correct approach involves a comprehensive evaluation of the CLIA method's performance against established performance specifications and regulatory requirements. This includes assessing critical performance characteristics such as accuracy, precision, linearity, analytical sensitivity limit of detection, and interference. The laboratory must demonstrate that the method consistently produces results that are within acceptable limits for patient care and meet the requirements of regulatory bodies like the FDA and CLIA, Clinical Laboratory Improvement Amendments. This approach aligns with the fundamental principles of good laboratory practice, GLP, and ensures that patient results are reliable, thereby protecting patient safety and upholding the integrity of diagnostic testing. The regulatory framework mandates that laboratories operate in a manner that ensures the quality and accuracy of test results. Incorrect approaches analysis. One incorrect approach is to rely solely on manufacturer-provided performance data without independent verification. While manufacturers provide valuable information, regulatory bodies require laboratories to validate methods within their specific operating environment. Failure to do so can lead to the use of a method that performs inadequately in the hands of the laboratory, potentially resulting in misdiagnosis or inappropriate treatment. This violates the principle of laboratory self-governance and the requirement for robust method validation. Another incorrect approach is to implement the method without establishing appropriate quality control procedures. Quality control is essential for monitoring the ongoing performance of an assay and detecting any deviations from expected results. Without QC, the laboratory cannot be assured that the method is functioning correctly on a day-to-day basis, which is a direct contravention of CLIA regulations. A third incorrect approach is to assume that a CLIA method, once validated, will remain consistently accurate without periodic reevaluation. Analytical methods can drift over time due to various factors. Regulatory guidelines necessitate ongoing monitoring and periodic revalidation or verification of performance to ensure continued fitness for purpose. Neglecting this can lead to a gradual decline in performance that goes undetected, compromising patient care. Professional reasoning. Professionals in clinical chemistry must adopt a proactive and systematic approach to method implementation and ongoing performance monitoring. This involves 1. Thoroughly reviewing manufacturers' claims and understanding the underlying technology. 2. Designing and executing a comprehensive validation plan that assesses all critical performance characteristics relevant to the intended use of the test. 3. Establishing robust quality control procedures with clearly defined action limits. 4. Implementing a schedule for periodic performance verification and revalidation as needed. 5. Maintaining detailed documentation of all validation and quality control activities. 6. Staying abreast of current regulatory requirements and guidelines from bodies such as the FDA and CMS, Centers for Medicare and Medicaid Services, under CLIA. This structured decision-making process ensures that analytical methods are fit for purpose, reliable, and compliant with all applicable regulations, ultimately safeguarding patient well-being. Question 19. System analysis indicates that a physician urgently requests the result of a radioimmunoassay RIA for a critical patient. The laboratory's quality control, QC data for the RIA assay indicates that the control samples are outside of the acceptable range. The laboratory professional is aware that reporting patient results without acceptable QC is a violation of established protocols and regulatory guidelines. The physician insists that the patient's condition is deteriorating and that any result, even if preliminary, is better than no result. What is the most appropriate course of action for the laboratory professional in this situation, adhering strictly to the regulatory framework and ethical guidelines governing clinical laboratories in the United States? Option A. Refuse to perform the RIA until QC is acceptable, and inform the physician that no result can be provided until the assay is validated. Option B. Immediately initiate corrective action for the out-of-range QC, and if the QC can be brought within acceptable limits promptly, then report the patient's RIA result. Option C. Report the patient's RIA result to the physician, explaining that the QC data is currently out of range but that the result may still be clinically useful. Option D. Perform the RIA on the patient, document the out-of-range QC, and report the patient's result with a clear disclaimer indicating the QC issue. The correct answer is C. Report the patient's RIA result to the physician, explaining that the QC data is currently out of range but that the result may still be clinically useful. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a potential conflict between a laboratory's established quality control procedures and a physician's urgent request for a result that bypasses these protocols. The physician's urgency, while understandable in a clinical context, directly challenges the integrity of the laboratory's validated methods and the reliability of patient care. The laboratory professional must balance the need for timely patient information with the ethical and regulatory imperative to maintain the accuracy and validity of test results. This requires a deep understanding of the principles of laboratory quality assurance and the potential consequences of deviating from them. Correct approach analysis. The correct approach involves a commitment to the established quality control, QC procedures. This aligns with the fundamental principles of laboratory practice mandated by regulatory bodies such as the College of American Pathologists, CAP, and the Centers for Medicare and Medicaid Services, CMS, through the Clinical Laboratory Improvement Amendments, CLIA. These regulations require that all laboratory tests, including radioimmunoassays (RIA), be performed under a comprehensive quality system that includes rigorous QC testing. Bypassing QC, even for a single sample, compromises the validity of the assay for that sample, and potentially for all samples run during that analytical run. It also violates the principle of ensuring that the test system is performing within acceptable limits before reporting patient results. Maintaining QC integrity is paramount to patient safety and the credibility of laboratory diagnostics. Incorrect approaches analysis. One incorrect approach involves immediately reporting the result without performing the required QC. This is a direct violation of CLIA regulations and CAP accreditation standards, which mandate that QC be performed and reviewed before patient results are released. Ethically, it represents a failure to uphold professional responsibility to provide accurate and reliable information. This action undermines the entire quality assurance framework and could lead to misdiagnosis or inappropriate treatment based on an unvalidated result. Another incorrect approach is to perform the RIA without the necessary radiopharmaceutical or reagents due to their unavailability, and then report a no result or unable to perform status. While this acknowledges the inability to perform the test, it fails to address the underlying issue of reagent availability and does not offer a solution to the physician's urgent need. A more proactive approach would involve communicating the reagent issue and exploring alternative testing methods or expedited reagent procurement, rather than simply stating the test cannot be performed. This approach neglects the collaborative aspect of laboratory-physician communication and problem-solving. A third incorrect approach is to perform the RIA on a different, less sensitive assay without informing the physician of the change in methodology. This constitutes a significant deviation from the requested test and a failure to communicate critical information. Reporting results from an unvalidated or different assay without proper notification is a breach of professional ethics and regulatory requirements for test validation and reporting. It can lead to misinterpretation of results and potentially harmful clinical decisions. Professional reasoning. Professionals facing such a dilemma should first acknowledge the physician's urgency, but firmly uphold the laboratory's quality standards. The decision-making process should involve 1. Clearly communicating the regulatory and quality requirements for performing the RIA, emphasizing the necessity of QC. 2. Explaining the potential risks of reporting unvalidated results. 3. Collaborating with the physician to explore acceptable alternatives, such as expedited QC, using a different validated assay if appropriate and clearly communicated, or arranging for stat testing at another facility if feasible. 4. Documenting all communication and decisions made. This systematic approach ensures patient safety, regulatory compliance, and ethical practice. Question 20. To address the challenge of integrating a new automated immunoassay analyzer into the laboratory's workflow, what is the most appropriate initial step to ensure accurate and reliable patient results while adhering to regulatory standards? Option A. Implement the new analyzer for a limited set of non-critical patient samples to gauge its performance in a real-world setting before full validation. Option B. Rely solely on the results from the laboratory's next proficiency testing cycle to confirm the analyzer's performance before initiating patient testing. Option C. Immediately begin routine patient testing after basic operator training, assuming the manufacturer's specifications are sufficient for clinical use. Option D. Conduct a comprehensive analytical validation study, including accuracy, precision, linearity, and interference testing, alongside staff training and proficiency testing setup. The correct answer is D. Conduct a comprehensive analytical validation study, including accuracy, precision, linearity, and interference testing, alongside staff training and proficiency testing setup. Explanation. Scenario analysis. Implementing a new automated immunoassay analyzer in a clinical chemistry laboratory presents a significant challenge due to the potential impact on patient care and regulatory compliance. The primary challenge lies in ensuring the accuracy, reliability, and safety of patient test results during and after the transition. This requires meticulous validation, staff training, and ongoing quality control, all within the framework of CLIA regulations. Failure to adequately address these aspects can lead to erroneous diagnoses, inappropriate treatment, and potential patient harm, as well as regulatory sanctions. Correct approach analysis. The correct approach involves a comprehensive validation process that includes analytical performance studies, accuracy, precision, linearity, detection limits, comparison studies with the existing method, and assessment of interference from common endogenous and exogenous substances. This is mandated by CLIA regulations, which require laboratories to establish and maintain quality control procedures that verify the performance of all laboratory tests. Thorough staff training on the new instrument's operation, maintenance, and troubleshooting, along with the implementation of a robust proficiency testing program, are essential to ensure consistent and reliable results. This systematic approach minimizes the risk of introducing errors and ensures that patient results are dependable for clinical decision-making, aligning with the CLIA requirement for competent personnel and accurate testing. Incorrect approaches analysis. Implementing the new analyzer without a comprehensive validation study, relying solely on manufacturer specifications, is a significant regulatory and ethical failure. CLIA requires laboratories to independently verify the performance of analytical methods before routine use. Manufacturer data alone does not satisfy this requirement, as it may not reflect the laboratory's specific operating conditions or patient population. This approach risks reporting inaccurate results, violating CLIA mandate for accurate and reliable testing. Introducing the analyzer into routine patient testing immediately after basic operator training, without performing comparison studies or assessing interference, is another critical failure. This bypasses essential steps in method validation, potentially leading to systematic errors or biases that could affect patient diagnosis. It directly contravenes CLIA quality system requirements, which necessitate a thorough evaluation of a new test system's performance. Relying solely on proficiency testing results to validate the new analyzer without conducting internal analytical validation is insufficient. While proficiency testing is a crucial component of quality assurance, it is a retrospective assessment of overall laboratory performance and does not replace the need for prospective validation of a new analytical method. This approach fails to proactively identify and correct potential analytical issues before they impact patient care, violating the spirit and letter of CLIA quality control mandates. Professional reasoning. Professionals must adopt a systematic and evidence-based approach to implementing new technologies. This involves understanding and adhering to all applicable regulatory requirements, such as CLIA in the U.S. The decision-making process should prioritize patient safety and the integrity of test results. This means conducting thorough validation studies, ensuring adequate staff competency through comprehensive training, and establishing robust quality control measures before introducing any new analytical system into routine patient care. A proactive, risk-averse strategy, grounded in regulatory compliance and scientific principles, is paramount.